And we heard from the MDHHS Director Elizabeth Hertel this morning about the expected wave of Omicron cases in Michigan. Tonight, we're expanding on that conversation in our 7 Upfront tonight, and Elizabeth joining us again. Thank you for being with us again.
Thank you for having me.
A federal emergency response team, we are being told, is heading to Michigan. Do you know how many people, where they'll be sent, and how they're going to help?
Well, we already have 3 federal teams in the state right now. One is at Beaumont Dearborn. We have one in Saginaw and one in Grand Rapids. And this one will also be going to the west side, to the Muskegon area.
Okay, and so also hearing too that the president announced plans to send millions of at-home COVID tests to Americans. What are the steps once someone takes an at-home test and gets a positive result?
If somebody takes an at-home test and gets a positive result, the first thing they should do is probably call their provider. If they're not experiencing severe symptoms, generally we'd want to have that test verified with a PCR test, the one that takes a little bit longer, to identify if in fact that is a COVID case. If they are experiencing symptoms, contacting their provider, asking them about therapeutics, if they're a good candidate for the monoclonal antibody therapies, and if they are experiencing very severe symptoms and are in an emergency situation, they should absolutely go to an emergency room.
So are you required to report it to the state? And if not, how does that impact the numbers that we see every day?
We do not get all of the at-home or the rapid test results reported to the state. Generally, though, when we see somebody taking a rapid test, we would like to see them get that verified with a PCR test, the one that takes a little bit longer, and that test is then reported to the state.
So back to those federal helpers, what exactly are they doing to help us out in our hospitals?
They are helping to decompress our emergency departments. As you know, our emergency departments are filling or at capacity or over capacity in some situations. There are a number of emergency departments across the state who have had to delay taking in emergencies for extended periods of time. And these teams are able to assist decompressing that pressure in the emergency department, as well as in this situation, assisting with some of that therapeutic administration.
Well, our hospitals overrun. We've been talking about that, and we've heard many people say, you know, trying to talk to people about getting a vaccination at this point who have not is like preaching to the choir. Our rate, Detroit, significantly lower than the state's vaccination rate, 36% of those eligible fully vaccinated. Our hospitals, we've been talking about on the brink. So talk to us about the concern for Detroit in the light of Omicron.
We are working very hard to make sure that people have access to the vaccine wherever they are, and that we are answering those questions with accurate information. I think, though, Dr. Schmidt, who spoke this morning, was probably one of the more persuasive people that I've heard speaking, in that she is seeing this firsthand with families who are having to say goodbye to their loved ones because they were not vaccinated. And she's asking people, and I think we have multiple physicians across the state and nurses and other providers who are seeing this every day and begging people to trust them as healthcare providers to take this vaccine so that they can save their lives and other people in their life as well.
Yeah, it really was quite passionate and poignant about trust and what needs to be done. On the topic of our schools, you know, returning in winter in the middle of this new Omicron wave, should schools be implementing testing requirements before students come back?
We have been able to, over the past 4 to 6 weeks, implement our new My Backpack program. We have 120 schools who currently are interested in participating and continue to add schools every day, where we are able to send them those at-home tests. They can put those in their kids' backpacks, and those students can take them home so that they can use them either for the students or anyone in the household who may have been exposed. And we will continue at the state level in coordination with the federal government to make sure that we are making those tests available to as many people across the state as need them.
Well, we certainly appreciate your time again. Elizabeth, thank you for being with us. And this is a fight that we all are in and continuing to be in.
Thank you for having me.